بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائنا طلبة المرحلة الثالثة وحياكم الله جميعا. To continue with the practical lectures of pathology, we will start with the tumor pathology because it is very important chapter and considered as basic for applied or systemic tumor pathology when we call about it in systemic pathology. For example, renal pathology or tumor of respiratory pathology. فلازم يكون عندنا في overview or short notes about the general tumor pathology حتى نفهم systemic أو applied tumor pathology. Definition of tumor or neoplasm اللي هو more scientific. A tumor is an abnormal mass of tissue resulting from autonomous progressive excessive proliferation of body cells which not integrated into normal tissue. يعني uncontrolled proliferation of cells forming abnormal tissue mass isolated from the normal tissue from which it arose. There are common causes of tumors. The most common causes is chemical, viral and physical. Chemical as carcinogenic disease or cigarette smoke. Viral as adenovirus, human papilloma virus, Epstein-Barr virus, and so on. Physical agent as radiation, ultraviolet, and so on. When one or more of these causes induce mutation, and this mutation lead to inadequate activation of a proto-oncogene together with inactivation of a tumor suppressor gene and differentiation gene that regulate developmental growth of tissue. This will result in unregulated proliferation with resulting in tissue growth, and unregulated differentiation with resulting in anomalous tissue, which is the neoplastic transformation. Definition of a proto-oncogene: normal gene sequence whose gene product contribute in regulating cellular proliferation. When it is abnormally activated, they can transform the normal cell into malignant cell. Also tumor suppressor gene, or called anti-oncogene. Gene whose product physiologically inhibits cell proliferation. Therefore it is called anti-oncogene. Promote cell differentiation and also suppress some steps of carcinogenesis and metastasis. This figure illustrate briefly the mechanism of neoplastic formation, starting from the causes, chemical or viral or physical, and these causes should be induce mutation in cellular DNA, and this mutation necessary to induce hyperactivation of proto-oncogene and inactivation of tumor suppressor gene and differentiation gene, resulting in unregulated proliferation and unregulated differentiation, leading to abnormal tissue growth, which is a neoplasm. Tumor or neoplasm generally classified according to biological behavior and malignancy status into benign tumor and malignant tumor. This is figures only illustrate examples about causes. The first one is laryngeal papilloma. Papilloma means benign epithelial tumor arise in the epithelial surfaces and appear macroscopically as visible finger-like projections, but it is benign. While cervical carcinoma, it is malignant neoplasm of uterine cervix. Both tumor are caused by human papilloma virus. This figure is only to illustrate the causes of tumor. The term of nodules, tumor or nodules or mass, are non-specific for description of neoplasm. And as we know, in the one of the cardinal signs of acute inflammation is tumor or means swelling. إذا تذكرون أخذناها بالacute inflammation. It is not restricted to description of neoplasm, but may refers to any abnormal swelling in the body, while the term of neoplasm refers to or restrict to description of neoplastic abnormal growth, and may be benign neoplasm or malignant neoplasm. The benign neoplasm, characteristic features of benign neoplasm are well circumscribed by fibrous connective tissue capsule, and therefore it is not invasive and not infiltrative to surrounding normal tissue, and not metastasized to distant organs in the body, and do not recur after surgical resection, and its outcome is mostly not fatal. But there are some exceptions, such as tumors that arise in vital anatomical location, as benign pituitary tumors that can cause mechanically compressive and atrophy of normal glandular tissue structure, resulting in hormonal disorders which may be life-threatening. Other example, the tumors that associated with excessive hormone production, such as islet cell adenoma of pancreas, which may lead to fatal metabolic derangement due to hyperinsulinemia causing hypoglycemia. Nomenclature of benign neoplasm. The name of or terms of benign neoplasm often end with OMA, O-M-A, but not necessary. For example, adenoma is a benign neoplasm derived from glandular epithelial tissue. Fibroadenoma, benign tumor derived from fibrous connective tissue and glandular epithelium, as benign neoplasm of breast. Leiomyoma, a benign neoplasm of smooth muscles. Also, other term is polyp. Polyp is a benign neoplasm which produce macroscopically visible projections on epithelial surfaces of gastric or colonic mucosa, but if it is contain glandular structure, it is called adenomatous polyp, as you see here in these figures, which is a typical example of colonic polyps. This grossly appear in figure B, and macroscopically appear as dome-like structure project into colonic lumen and covered with neoplastic epithelial lining, and containing benign neoplastic glandular structure, and still attached with a clear stalk with the other mucosa. This is called adenomatous polyps. It is a typical example of adenomatous polyp. Malignant tumors. Features of malignant tumors or behavior of malignant tumors is in contrast to benign tumors. It is all defined and not circumscribed by fibrous connective tissue, and therefore it is invasive and infiltrative to surrounding tissue and may metastasize to distant tissue or organ in the body, and may recur after surgical resection, and its outcome is invariably may lead to fatal or may lead to death or no. The cancer term is mostly or refers to malignant. Description or term refers to malignant tumor. Nomenclature of malignant neoplasm. The name of malignant neoplasm often end with carcinoma, suffix of carcinoma or sarcoma. Carcinoma refers to malignant neoplasm derived from epithelial tissue. Sarcoma, malignant neoplasm derived from mesenchymal or connective tissue cells, such as fatty cells or muscles or fibers. Examples of malignant tumors: adenocarcinoma, malignant neoplasm of glandular structure; rhabdomyosarcoma, malignant neoplasm of skeletal muscle; leiomyosarcoma, malignant neoplasm of smooth muscle. There are some exceptions which not end with suffix of carcinoma or sarcoma, such as lymphoma, malignant tumor derived from lymphocyte; hepatoma, malignant neoplasm of liver; seminoma, malignant neoplasm of germ cell in the testis; melanoma, malignant tumor of melanocyte; mesothelioma, malignant tumor derived from mesothelial cells; germ cell tumor, malignant neoplasm derived from germ cells. Here, very important terms used to describe microscopic feature of neoplasm, particularly the malignant neoplasms. The first one is differentiation. Differentiation means how histologically the tumor tissue resemble the normal tissue from which it arose, and we use in differentiation different terms to description differentiation. Well differentiation if the tumor is well differentiated, or moderately differentiated, poorly differentiated, or undifferentiated, or completely differ than normal tissue. The second term is anaplasia. Anaplasia means lack of differentiation or complete differentiation. The third term is dysplasia. Dysplasia means disorderly growth epithelium characterized by loss of normal cellular uniformity, and orientation means loss of polarity, abnormal orientation, and associated with increased number of mitotic figures. It is not necessarily transformed to tumors, but mostly or in many cases the dysplasia is the precursor of malignant tumors. But when the inciting agent is removed, the dysplasia may return to normal state. It is reversible change. Carcinoma in situ, it is the first step of malignant transformation of epithelial lining. It means full thickness and high grade irreversible dysplastic change of epithelium with intact basement membrane. It is not invasive, but it is the first stage of malignant transformation. Here, figure illustrates a typical example of malignant microscopic feature, which characterized by pleomorphism means there are different sizes of cells and nuclei, and high nuclear cytoplasmic ratio, and hyperchromatia means clumping of chromatin and thick dark hematocytic stain, and hypercellularity. In the center, also in the center, presence of abnormal mitotic figure, tripolar mitotic figure. An increased number of abnormal mitotic figure indicated the malignant tumor, considered as indication of malignancy. In addition to loss of normal arrangement and cellular uniformity means loss of cellular polarity, loss of polarity. Other terms, pleomorphism. Pleomorphism means different size in cells and nuclei, means some cells and nuclei very large, others medium, and others very small in size. Loss of polarity, حكينا عنها. Mitotic figures, increased number of abnormal mitotic figures, indication of malignant transformation. The infiltration will invasion to surrounding tissue and blood vessels, lymphatic vessels. Tissue destruction, also adjacent tissue. Metastasis, it is a characteristic of high malignant tumor or malignant tumor, means detachment of small mass of malignant tumor from the original mass and metastasize and disseminate through either hematogenous or lymphatogenous into distant organ or tissue. And the lower figures reveal the malignant typical example of malignant tumor in skeletal muscle. It is rhabdo malignant tumor of skeletal muscles, rhabdomyosarcoma. And the figure A reveal the normal structure of skeletal muscles, characterized by a normal arrangement of skeletal muscle fibers and the nuclei located in the periphery of muscle fibers, with normal eosinophilic color of muscle fibers and nuclei, while in the malignant microscopic field there is hypercellularity and hyperchromatia, dark nuclei and the clumping of chromatin, and there is clear pleomorphism, means some of cells and the nuclei very large and other with medium size and other very small cells, and undifferentiated cells with loss of normal polarity and orientation. Also there is multinucleated tumor giant cells characterized by large cytoplasm containing multiple nuclei. It is a microscopic feature of highly malignant tumor, typical example of rhabdomyosarcoma. This is other example illustrate the small mass of malignant tumor lodged in pulmonary lymphatics and trying to metastasize into lung or distant or other area. The dissemination or metastasis of tumors mostly occur either blood vessels hematogenous route or lymphatic vessels lymphatogenous route. Mostly the epithelial cells metastasize through the lymphatic vessels, while the mesenchymal malignant tumors metastasize through the blood vessels or hematogenous route. This is a typical example of lodging of malignant tumor mass in lymphatic pulmonary lymphatics. Other example about malignant tumor and compared between well differentiated and undifferentiated type. It is a squamous cell carcinoma. Squamous cell carcinoma in the figure B is well differentiated or moderately differentiated of squamous cell carcinoma, characterized by pleomorphism, and arranged the squamous neoplastic cell arranged as nest and produce their keratin, forming keratin pearls, indicating of malignant or squamous cell carcinoma. But the cells still resemble the normal squamous cell epithelium. Therefore, it is called or classified as moderately or differentiated squamous cell carcinoma. This type of tumor mostly occur in the skin, in the respiratory tract, or in the esophagus, while in contrast in this figure A, characterized by complete undifferentiated neoplastic cells, hypercellularity and hyperchromasia, and there is no keratin pearls, and highly invasive to surrounding tissue. The undifferentiated type, it is highly or high malignant than the moderately differentiated or well differentiated, and highly and high metastasis than well differentiated. Other example of malignant tumor is malignant melanoma. Malignant melanoma, it is a malignant tumor of melanocyte due to induced by mutation of melanocyte DNA, mostly, or induced by ultraviolet from long exposure to sunlight. The behavior of growth, it is either grow superficially or radially and not metastasize to distant sites, or may grows vertically and infiltrate the underlying dermis and mostly metastasize. The most risk factor is sunlight due to ultraviolet. Right. Here grossly we see the two nodules characterized by variable pigmentation, some area dark pigmented and other intermediate or pale, and also the other nodule with irregular borders of two nodules, and at the background of dark brown skin may indicate the infiltration of melanocyte into the adjacent area. Mostly its size may reach to 10 millimeter in diameter. Microscopically, the neoplastic melanocyte appear as nest of cells producing their melanin, or may present as individual malignant melanocyte invaded and distributed in the underlying tissue and produce or appear overloaded with their melanin. It is a malignant tumor of skin. Other typical example of malignant tumor are osteosarcoma. Osteosarcoma is a highly malignant bone tumor, maybe primary or secondary to Paget disease, and the most common location is metaphysis of long bones such as distal part of femur or tibia or humerus. Also occur due to mutation in retinoblastoma gene or p53 gene. Morphologically, grossly appear as a gray or white mass, malignant tumor mass containing areas of hemorrhage and necrosis, which are the features, mostly the features of gross features of malignant neoplasms. The radiographic feature of osteosarcoma is a Codman triangle. Codman triangle means triangle shape. The tumor mass form triangle shape due to rapid growing of neoplastic cells, lifting the periosteum of bone from the cortical bones and invading or lifting the surrounding tissue and invading the distal epiphyseal tissue, forming a triangle shape. What we call it a triangle or Codman triangle in radiographic feature, and also in gross feature. It is clear here. Microscopically appear with highly malignant characteristics. There are severe pleomorphism, different size in cells and nuclei, and loss of polarity, haphazard arrangement of cells or loss of polarity. The neoplastic cells, osteoplastic cell producing lossy or lost bony tissue or unmineralized tissue, which appear focally calcified here, focal calcification of bony tissue, and hyperchromasia with multinucleated giant cells of bone tumor giant cells. It is highly malignant type of bone tumors. Other typical example of brain tumor is a glioblastoma multiforme. A glioblastoma multiforme. It is a high malignant type of astrocytoma, a highly malignant type of astrocytoma, because the astrocytoma classified into several types. The highly malignant type is glioblastoma multiforme. الفور type مالته اللي هو الهاي جريد according to classification of WHO, and the peak incidence is at 40 to 60 years old persons, but can occur in any age. The most common location مالته mostly arise in cerebral hemisphere, but can occur in other site as brainstem. Grossly here appear well circumscribed, but in fact it is highly infiltrative to surrounding tissue. It is highly infiltrative to surrounding tissue and containing areas of necrosis and hemorrhage, which appear clearly in microscopic appearance. As here, this is area of necrosis, and surrounded with pseudo-palisading neoplastic cells which appear surrounding the necrotic area, and here newly microvasculature, which newly microvasculature with necrosis is indicating, mostly indicating of glioblastoma multiforme اللي هو الفور type of astrocytoma. Here other example of metastasis of neoplastic tumor into bone marrow. In figure A illustrate the normal structure of bone marrow containing the normal bony trabeculae with other normal hematopoietic tissue, fatty globules, and other hematopoietic tissue indicating by large megakaryocytes and other lymphoblast, myeloblast, and erythroblast, and other normal component. In contrast, this bone marrow appears with complete replacement of normal hematopoietic tissue with sheets of highly malignant and undifferentiated hypercellularity, hyperchromasia, completely invaded and replaced the normal hematopoietic tissue, only remaining of the normal present bony trabeculae. It is a typical example of metastasis into bone marrow. The consequence of this tumor, mostly the person undergo with recurrent infection due to depression of original source of white blood cells, anemia, and bleeding due to replacement or absent source of platelets, and other disorders. The last slide illustrates the teratoma. Teratoma originated from the totipotential germ cells which are present in testis or ovary. Classified into mature teratoma اللي هي دائما تكون benign or sometimes immature, some reference classified as malignant tumor. Although the neoplasm, even the mixed type, is derived from single germ cell layer, but the teratoma, mostly the teratoma derived from 2 or 3, originate from 2 or 3 germ layers, means layers of embryogenesis, embryogenesis, ectoderm, endoderm, and mesoderm. The teratoma can be arise from three layers and forming different mature structures, as here this figure illustrates typical mature ovarian teratoma. The ovary appear as cystic structure filled with fully differentiated different structure derived from different layers of germ cell layers, containing sebaceous material due to proliferation of sebaceous gland, and fats due to presence of fatty differentiated cells, and also here clear hair and hair follicle due to a differentiation of hair follicles, and also presence of teeth in this ovarian teratoma. And this microscopic feature illustrates this gross appearance of mature teratoma. اوكي شباب، احنا بالنسبة للحكي النظري اللي بالبداية اخذناه كclassification definition الميكانيزم pathogenesis، هذا only to understand الفيجرز either grossly or microscopically. بس الشيء اللي يهمنا هو الفيجرز with description descriptive terms of microscopic gross appearance والmicroscopic appearance of benign and malignant neoplasms either grossly or microscopically. والسلام عليكم ورحمة الله وبركاته.